Hello and good evening, everyone. Welcome to 365 Live. My name is Gary and I'll be your host for tonight's live session. Tonight's talk on physical activity before, during, and after cancer treatment is brought to you by Choo, Senior Physiotherapist at 365 Cancer Prevention Society. Now, for tonight, just a gentle reminder that all information shared at this event by the speaker and 365 CPS is for general information only. So please do consult your doctor for personalized and detailed medical advice. Well, we are here for a reason. So without further ado, I would like to kick off tonight. I'm pleased to introduce tonight's speaker, Choo. She's a senior physiotherapist at 365 Cancer Prevention Society, and she's here tonight to share all about palliative care and supporting you on your cancer journey. So as always, if you have any questions, please feel free to post them in the chat and Kai Bing will address them. And well, here she is, Kai Bing. Thank you so much for sharing, being here tonight and willing to share all of your knowledge with everyone.
Hey, hi, good evening, everyone here, and of course, good evening, Gary.
Yeah, so the topic tonight is on physical therapy. Does that mean that we or cancer patients or cancer survivors need to hit the gym? Is that what physical therapy or physical activity, I should say, is about?
Yeah, so we will be touching on what physical activity is. So commonly, gym sounds a bit daunting, especially, you're going through treatment and all. But let's debunk this belief that we have to be hitting the gym all the time, even during, before, or after our cancer treatment.
Yeah, and of course, if somebody's undergoing cancer, are they allowed to exercise hard and push hard? I assume that's what you're going to be covering this evening.
Of course, so they can exercise, but that hardness, we will be defining it later on as well, and you will find out what are the hardness you'll be going at later on.
Okay, perfect. Well, that sounds amazing. So please, everybody, take notes, tune in, and I'm going to hand the time over to you, Kai Bing. Take it away.
All right. Thank you, Gary, and thank you all of you here for taking the time off your precious weekend. We will be exploring together about physical activity and the benefits of physical activity at the various stages of cancer treatment. So let's begin. First, we will understand what is physical activity definition, what is Singapore's physical activity guideline, and exploring the benefits of physical activity, especially at the varied phases of treatment. And later on, we will spend a short 5 minutes doing a desk side exercise. So, physical activity is defined as any bodily movement produced by contraction of your skeletal muscles that require energy expenditure. So, what does it really means? Exercise, the more common term that we use, is actually only a subcategory of physical activity. Exercise actually refers to something that is purposeful, planned, structured, and repetitive for a certain improvement that we are looking at. So, for example, today I want to build my biceps muscles. I'm going to repeat a lot of like elbow curls, bicep curls, just to build that certain muscles group. But physical activity is about engaging major muscles group, different movements, so that we are not targeting only certain part of our body. So exercise also, we split them into three different categories, which is the aerobic exercise that builds our heart and lung function, strengthening exercise that build our muscles and bones, and flexibility exercise that maintain or improve our joint range. Today, our main focus is not just about exercises, it's about physical activity in general. So let's pause for a moment here and let's recall what is the Singapore physical activity guideline that you guys know. Does this 150 minutes number sounds familiar to you guys? So actually our Singapore Health Promotion Board launches this National Physical Activity Guideline back in 2021. And the guideline says that adults should engage in 150 minutes to 300 minutes of moderate intensity aerobic activity per week. I've put up a QR code over here that if you guys are interested, you can just scan a QR code, brings you to the link, And if you read this whole guidebook, this is just the starting or the first part of this guideline. If you read further down, they actually says that, hey, we should be doing strengthening muscles, bones, and joints through different activity at moderate or vigorous intensity 2 times a week. And of course, beyond exercising, we are supposed to incorporate physical activity into our daily routine as well. So I think 150 minutes is pretty easy to take count, right? Just looking at the time and all. But how about the intensity? What is moderate intensity? So activity intensity, we can monitor them with two different methods. One is by the heart rate, and the other one is by our own subjective perceived rate of exertion. So I think it's pretty easy to monitor heart rate if you've got a smartwatch nowadays. Even with the numbers that we see on the smartwatch, how do we know whether we are working moderate intensity or light intensity? I'm going to bring you guys this special number or magic number over here, 220. So to calculate or to monitor your own maximum heart rate, this will be individual. You use 220 minus your current age. So today, we know our maximum heart rate is 220 minus our current age. So for example, if I'm 30 this year, my maximum heart rate would be 220 minus 30. That will bring me to 190 minutes. That's my max heart rate. And if I were to work out at moderate intensity, I will use this max heart rate 190 to times 70% or 0.7. So using my calculator, I'll be able to get the number that is specific to me this year. And then next year, the number would change again. So every year, this will be different. So that's why if you're slightly younger in age, you probably got to work slightly harder to hit that moderate intensity. But if you're slightly older in age, then you might only need to walk a little bit faster to be able to hit that moderate intensity. Now, I understand that not everybody can have like smartwatch together with you while you're exercising and all. Now, I'll bring you guys to this another VIT metrics that I love to use because there's no calculation involved. It's really about asking yourself how hard you are going. So this chart over here, 1 to 10, is actually a rate of perceived exertion that you feel. If you are feeling that you're not doing anything at all, you're hardly exerting anything, any energy, that's likely a very light activity. For example, just sitting down, listening to me right here, right now, or watching a TV show. So that's likely a very light activity that you are doing. Light activity could be you are doing something that you can engage for long hours. For example, just walking around the park under your void deck, or even just going window shopping at the supermarkets or in the shopping mall. Something that you know that you can be continuing for hours. That's likely some light activity that you're doing. Moderate activity means that you're doing something that you start to breathe slightly harder. But if someone were to speak to you by your side, you can still answer them. But if I ask you to sing a song while you're doing that certain activity, you probably won't be able to. So for example, I am mopping the floor. I am mopping the floor, mopping the whole room. And if my family member come about and ask me that, hey, Clapping, where did you put your socks? I'll be able to still be able to answer that, hey, it's in the cupboard, in the second cupboard, etc. But if they were to ask me to, hey, let's sing this song together as the video is playing, I probably would not be able to complete the full song or that full sentence because I'm actually working at moderate intensity as I am mopping the ground. Now, vigorous activity or grading a rate of 7 to 8 is whereby I'm feeling short of breath. If you ask me something, I probably could answer you yes or no, but I probably can't give you like the full sentence. For example, if you ask me where I live, I won't be able to give you my full address because I am feeling some shortness of breath right now. If you're working very hard activity, how do you know? Is when you feel that you can hardly continue this any further. Maybe 1 or 2 times of this activity that you're doing, that's it. You have to stop immediately. So that's when the exercises is too hard for you. That's when you're working at vigorous intensity. So today, we only need to take note of the moderate intensity. So remember, if you're doing a certain activity that is you're using energy, you're feeling slightly short of breath, but if someone speaks to you, you can still hold short conversation or answer with a short phrase or 1 or 2 words. That means you are working at moderate activity. All right, so now we've talked about how we monitor our different physical activity intensity. We move on to the topic to talk about the benefits of physical activity at the various stage of our cancer treatment. Now, before cancer treatment, should we actually be exercising? Now, if we exercise before going for our cancer treatment, actually helps to preserve our muscle strength even before the atrophy of our muscles takes place during treatment or after surgery. Giving a more practical example, look, our phone battery, for example. If you charge your phone to a full battery, 100% right now, and you just leave your phone there for 2 days, do you think the battery would stay the same at 100% 2 days later when you look at your phone? Or you felt like the battery would slowly deplete? They would drop a little, right? Because background, some apps are probably still running. Your phone is still on standby, ready for you to use at any other time. That's the same thing applies to my muscles. If I don't do anything to it, I'm just sitting down waiting for my cancer treatment to start. I'm actually allowing my muscles to go into the muscle loss phase. And then if after treatment I want to get back starting, it'll be a little bit harder. So the reason for doing exercise or maintaining some physical activity before cancer treatment is to make sure that you prevent the muscle loss, maintain your heart and lung function, and you optimize your recovery after your treatment. Some of the psychological benefits include being prepared physically for treatment. Actually helps to alleviate your anxiety and stress because you know that you're in a better physical shape that can give you a sense of control and improve this mental readiness for the upcoming treatment because you know you're able to go through this phase of cancer treatment. And other specific cancer-related benefits, actually the enhancement of your body resilience. As you do exercise or engage in physical activity, they actually boost your immune system in general. If I were to go for any treatment, be it cancer or be it just for any surgery, if you're running a fever, if you're having a flu, very likely the surgery is going to postpone. Very likely the treatment is going to postpone. So if I want to be on track with my treatment plans, I want to make sure that I've got better immune system, making sure that I'm not sick before any treatment starts. So the recommended physical activity intensity levels for individual before, during, and after cancer treatment varies depending on your individual health. But in general stage, for before cancer treatment, we recommend working at moderate intensity for 150 minutes a week, just like any healthy individuals before going or attending any of your surgery or cancer treatment. Now, if we move on to during our cancer treatment, what should I be doing or what are benefits of doing exercises while during cancer treatment? Number one, if I continue my physical activity, I can actually lessen the fatigue. Although it seems a bit contrasting, you'll be like, hey, I'm actually tired right now, but should I still move more? Would I be more tired as I move more? I'm already lacking that energy. But when you exercise, you're actually increasing this energy threshold. You're actually increasing the muscles, you're warming them up so that you will feel actually more energetic rather than fatigue over time. And also, when you exercise or engage in physical activity, you actually improve digestion and bowel movements, which will actually improve your nauseousness. So what is the nauseousness effect from chemotherapy? You just feel like even if I'm eating nothing, I just feel I want to vomit. If I eat something, I will definitely vomit. But that means that the food is in your stomach, it's not going down, reaching your intestine yet. But if you engage in some light exercises during the cancer treatment, you actually help with that digestion speed. You actually get the food going down into your intestine, which is why you won't feel so nauseous, or rather you will not vomit so often after having your meals, especially with affected appetite. It decreases pain. I actually don't mean reducing the pain at the operation site. If I had a shoulder operation, if I keep moving that shoulder joint, I might not reduce pain, it might cause more pain, right? But sometimes this movement might not be targeted just at where you had your surgery. What I mean is you can be doing exercises or movements in your hip, in your neck, or in your legs, so that your joints don't stiffen up. The joints that is not affected during surgery doesn't stiffen up, so you will not feel so much pain. Then, of course, the surgical site movement can be advised by either your surgeon or even physiotherapist that is in charge. Now, continuing exercise also helps to maintain your muscle mass and strength. So earlier on, remember I was telling you like how before surgery you should be doing some exercise to maintain your muscle so that it does not go into muscle loss so quickly. Same thing, if I continue using my muscles or continue doing some physical activity, I'm actually maintaining big muscles group power, and I slows down the atrophy of the muscle strength as well. And of course, similarly as before, regular exercise supports your immune system, helping your body better fight infection, and that's when you can recover or benefit from your cancer treatment more. I understand that cancer treatment can also take a mental toll, like feelings, anxiety, depressed, or even stress. But when we exercise or when we move, we actually stimulate this release of hormones called the endorphins, which are natural mood enhancer. So this natural mood enhancer can actually help to elevate some of this anxious feeling. So coming to the recommended intensity, although we were encouraging moderate intensity earlier on before your treatment, I do understand that sometimes during cancer treatment that your body can just be feeling really fatigued and lethargic that day. You can adjust the intensity to low intensity or light intensity, sometimes just by walking around, walking in your room, walking around your house, some light walking, or even some gentle stretching at home. Listen to your body, move as much as move as little as you can. You don't have to keep 150 minutes a week. Even 20 minutes would do, and you can slowly increase this 20 minutes to 60 minutes and eventually hitting that 150 minutes per week. But of course, if you are really concerned whether the intensity that you're working at is safe during your treatment, you can always consult your medical provider or healthcare provider, especially if you're dealing with very serious treatment side effects. Moving on to after my cancer treatment. So right now, I finished my treatment. I want to restore my energy. I want to restore my strength and function, right? Because I want to go and enjoy the rest of my holidays with my family members. How can we make this phase of recovery much easier? If we have already been engaging in physical activity before and during the cancer treatment, it's likely when your recovery becomes much easier because your muscles are not completely lost. They are still managed or maintained at a certain level, and you can slowly build on for there. Now, of course, you want to improve your mobility, especially the range of the joints that is affected by your operation. Like I mentioned earlier on, my shoulder stiffness or my shoulder operation. How can I exercise, do my stretching, do my mobility movements to improve that range so that after whatever treatment I've gone through, it doesn't affect the ability that I have to carry on with my daily activities. Now, they often persist even after treatment ends. So while rest is very important, physical activity also help to counteract this fatigue by increasing your energy level. Sleep disturbance, such as insomnia, can also be common after your cancer treatment. So while you engage in regular physical activity in the day, they actually improve your sleep quality at night. So you might find yourself not waking up as often in the middle of the night because your body is actually engaged in exercise or activity during the day. So at night, you're actually undergoing this restorative phase. So by engaging in physical activity, it actually help to make you sleep slightly deeper and slightly longer during the night. Last but not the least is long-term health. Now, several studies has actually suggested that engaging in regular physical activity can lower the risk of cancer recurrence, especially in hormonal-related cancers such as breast cancer, colon cancer, and prostate cancer. Overall, physical activity helps to improve your immune system. So that's when you can help to reduce chronic or long-term inflammation, which can contribute to reducing the risk of cancer relapse. Now, the recommended intensity is back to our moderate intensity or even to the vigorous intensity of physical activity. But of course, if you're unsure on whether you're ready to start, it's always good to talk to some physical trainer, a physiotherapist, or your surgeon even to understand what are the exercises that they recommend to do after your treatment. Now, today, modern lifestyle includes a lot of sitting. So it's just like me right now, I'm also sitting here talking to you guys. And especially for those online right now, if you're at home sitting down listening to me, I would like to introduce you to doing exercise by the desk. This is actually something that I do during work as well, because it doesn't take you long, just that quick 3 to 5 minutes to help to boost your alertness at work and reducing stiffness, which are commonly experienced during or when you are doing prolonged sitting. So I'll be doing alongside with you guys. So if you are at your desk right now, I will invite all of you to join me right now with these simple exercises. So first, we'll be doing our neck side stretch. So in sitting, you just have to drop your head to the side, use the opposite hand and pull to the side, feeling the stretch here in your neck. And for each stretch, we are going to hold them for about 30 seconds. So if I'm actually reading my screen or replying to my emails, I can take a short 30 seconds to think through what I'm going to type and write, and at the same time just performing my stretch. And of course, we will go to the opposite side as well. So I hope you guys are following me doing this in front of your screen, even though I don't see you guys. So you feel the stretch at the side of your neck. When you change movement, do it slowly so it doesn't cause any giddiness. Moving on, we'll be doing shoulder rolls. Again, in sitting, I'll just be rolling my shoulders front 10 times. And rolling them back 10 times as well. 8, 9, and 10. Now for our upper back stretch, get you to clasp your hands together, bring them up. You can even add on a little side twist. So for each stretch, we're going to be holding for 30 seconds. And we'll move over to the other side. So I see a question that say that is it bad if you stretch and your neck cracks? So sometimes you might hear this cracking sound when you're stretching. Then ask yourself, after that crack, do you feel more comfortable or do you feel more painful? If it's more comfortable, likely that the joint is stiff and that crack actually loosen it up. So you should feel more comfortable, and there's nothing wrong with that. But if you are feeling if you're feeling more pain when you do that, then I'll suggest you to just stop that exercise or that stretch for now and then move on to the other and just have it checked out, like what can cause the uncomfortable crack. Next stretch that we have is a spinal twist on the side. So sitting down, just turn your body to the side. You can use your hand to hook the back of the chair. You can see back of the chair. And then we'll move on to the opposite side as well. All right, and don't forget, even after our neck stretches and back stretches, we're gonna have our wrist and finger stretches, especially for those who do a lot of typings. So hands out in front, and then just bring them back, stretching up your wrist and your fingers. Okay, and we'll move on to the other hand. So by doing all these exercises, you can repeat them for a few sets. So I start from my neck, shoulder, back, finger, and wrist, and I can repeat this set again for about 2 to 3 cycles. Okay, and this will probably just take you about 3 to 5 minutes for a stretch, and you might likely feel more relaxed and relief after all this stretching. Remember, I mentioned about exercises having 3 different subcategories, which is your strength, the aerobic, and your flexibility. So now moving on to strengthening exercise. Is that something that I can do seated? If you have, if you are seated down, this is something that you can do. Sitting down, follow straightening your leg. Okay, I'm not sure whether you can see me well. Okay, so I'm just lifting up my leg straight, and I'll change to the other leg. And then I'll repeat again for 10 times each leg. So you can do this under your desk. Just make sure that you don't kick your colleagues that is sitting opposite you or in front of you. But of course, if space allow, turn your chair to the side and you can just straighten your leg doing a leg lifts. Right. So after 10 times of each leg, if you have any water bottle, have any water bottle beside you right now, grab them. If you don't, it's okay. Clench your fists for me, and then we will just do our simple bicep curls. Doesn't have to be a water bottle, even if you have a bottle of maybe lotion or hand sanitizer, or even your phone. They are made of weight as well. So you can be using simple weights that you can find on your desk to be doing your bicep curls for 10 times and using that same weight and doing your shoulder press upwards. So you move your shoulder up as well. Keeping it at a count of 10 so it's easier to remember. Okay, and last but not least, a core engagement whereby you do a knee touch. So seated down, if your chair are unsteady, please do not try this. If your chair is steady, then please feel free to do so. By unsteady chair, I mean some of the office chair that is like roller stool, and if you lean backwards, it can fall back. So for those who are seated down, having a steady chair, try this with me. Bring your knees to yourself for 10 times, engaging your core. 10. All right, so these are the two exercises that we can do in sitting. Now, if I have space, let's do something standing but at the same time, making use of our desk. So in standing, I'd like you guys to just do simple marking in place. The purpose of doing it by the desk is so that if you're feeling unsteady, you can always hold on to the desk for support and march in place to work your legs a little bit for 10 times. And heel raises. I don't think you can see my ankle, but I'm actually doing tip holds right now. So similarly, if my balance is not so great, I will hold on to my desk for support. And to build up a little bit of our thigh muscles, knees and hip muscles, we're doing mini squat. Just standing in front of your desk, holding onto your desk for support. You don't have to squat really low. So if you have any like bad knee pains, just a mini squat would do. Again, for 10 repetitions. Moving on to the fourth exercise, which is our leg lifts. You can hold on to your chair, or you can hold on to the table as well, and lift your leg sideways. So this strengthens up your hip and at the same time trains your balance a little bit because you're actually balancing on one leg right now as you're lifting the opposite hip. Okay, and similarly for the opposite side. So we have done our legs exercise. What about the standing desk exercise for my upper body, for my arms? That's when you can do a push-up or a plank. So you can, if you're not strong or you're afraid, you can just start off with putting your hands or elbows down by the desk and then just hold it there in the plank position. For those who are a little bit more confident, holding on by the edge of your desk, and you're just gonna do a push-up. So you don't need to do push-ups on the ground. I know many of us can't push ourselves up if we're on the ground. So you can modify it to something simpler, which is by the desk or even by the wall. Line, and that's 10 times. So here we go. We had our exercises for our arms. we had our exercises for our legs for strengthening. And of course, we started off with some of the stretches earlier on to loosen out our joints. So how long did we spend? I think we spent about 5 minutes or slightly more than that. So if I do this quick 5 to 10 minutes exercise or workout at work 3 times, that actually builds my 30 minutes of exercise for the day. So if I want to be able to do 150 minutes of exercise a week, this is how it can be counted in. But of course, we talk about the intensity as well. So if this exercise doesn't make you breathe any harder, chances is this will be too light for you guys. Either you go a little bit longer duration, or you got to do a little bit more heavier workouts, for example, holding a heavier weight. But that actually means that you have to prepare like some dumbbells or resistance band by the side to increase that weight. But overall, I just want you to guys to have the idea that exercises can be done or physical activity can be done anytime, any place, even at work. So take home message today is you can engage in physical activity whenever, wherever, but remember to monitor your own exercise intensity to know whether you are working out at moderate intensity, the one that you are aiming for, or you're working out at light intensity. Just because I'm not feeling really well right now, but I do still want to boost my energy level a little bit. So with that, I've come to the end of today's presentation. And I hope that you guys take home something from today, especially the monitoring of your own exercise and some simple tips and idea on what you can do by your desk if you're at work.
Before I close, do like, share, and follow us on all our social media pages to keep up to date with all our latest happenings and our events. So once again, thank you very, very much for joining us tonight. I hope to see you all in the next session. Until then, please take care, stay safe, and have a wonderful evening. Thank you.